Hi, Chiavare family, and welcome to our Endometriosis Awareness Month expert series. Today we are talking to Dr. Bree from Fem Fusion Fitness. Thank you so much, Dr. Bree, for being here all the way from Germany. It's amazing.
Yay, so glad to be here. Thank you for having me.
Of course. Could you introduce a little bit about your background and how you're working with women who have endometriosis and pelvic pain?
Yeah, definitely. My background is I'm a doctor of physical therapy. So I was working in the clinic when I lived in the United States, but now we've moved overseas for at least a temporary period of time. And my focus now is really online and just spreading awareness about pelvic health, women's health issues, and safe core strengthening and yoga and all sorts of women's wellness topics. And I do that over on YouTube, on my YouTube channel, and also by my book.
Yes, your YouTube channel is amazing. I'm going to put the link on the screen so women can go find it. You have tons of exercises on pelvic pain, women's health, managing inflammation, and ways just to stay healthy, stay stretched. When talking about endometriosis, there's so much pain. It's acute pain, it's aches, it's cramps. Sometimes, you have pain for a week. Are there exercises or tools women could be doing to help kind of mitigate that pain?
Yeah, for sure. And I think I don't personally have endometriosis, but I know lots of people who do, and I've worked with lots of people who do. And from the sense that I get from a lot of the women I work with and have talked to, is one of the worst parts of it is that it's so unpredictable. You just don't know how it's going to be from 1 month to the next, and from one, day to the next sometimes. And you don't know how the pain is going to present, and just, it's terrifying in some ways and frustrating. And I know people can feel with so many of these very personal issues that they can't really talk about it with everyone, because it's kind of although it shouldn't be, there's still stigma and kind of shame around this part of our body, the pelvic area of our body. And so I think that one of the biggest things that people can do to deal with the general condition of endo is to focus on relaxation, breathing, and self-care. And so deep belly breathing, it seems so basic and kind of boring maybe, but I think that it's one of the best things you can do to just focus on calming down the nervous system and kind of soothing yourself by yourself, just a self-soothing mechanism really, and reducing the stress hormones that are associated with pain and chronic pain issues, which really endo is. So that's one thing. There's actually lots of tips I can give you, but I think that's kind of a global starting place.
No, that makes sense. And the deep breathing that you're talking about, is that similar to a yoga breath? What does that look like? What does that feel like?
Yeah, the way I like to describe this is I call it core breathing, and it is exactly, it's like a yogic breath or a diaphragmatic breath. But the way I've been describing it lately, and I think it's really, really helpful for really visualizing the pelvic floor and really where we want the breath to go, is to have people sit or be however they're being, lay down even, whatever works for you. But picture your spinal column as the central channel of energy, and picture a ping pong ball. To me, it really helps to have this visual of a ping pong ball about that size. You can imagine a ball itself or just a ball of light. And imagine this ping pong ball going up and down that central channel of energy. And for me, for everyone, when you breathe in, what I want you to do is really inhale deeply, diaphragmatically, and expand the belly, and think about breathing down into the pelvic floor, like really breathing down into the pelvic floor. And so I like to picture that ping pong ball kind of suctioning down, like with a syringe, almost suctioning down into the pelvic floor, like way down into the perineum, and pausing there at the bottom of that inhale. So really suctioning that down, pausing, and that stretches and releases and relaxes the pelvic floor. And then when you exhale, you release, and all of the air, comes out, and your ping pong ball goes up to your crown, and then you pause. So you inhale, pause, and then exhale, pause. And if that doesn't work for you, that visual of the ping pong ball going up and down in that manner, that's fine. Do it the other way.
It works. It
doesn't work. Yeah.
Because I'm trying to calm myself right now. I'm getting ready to start my period. I know it's going to be a bad endo period. I can already feel it. And you're right. I think the body tenses up so much.
Yeah.
And when you just release and start that breath and that breathing, it kind of just self-soothes in a way.
It does. It does. It's the protective pain response. You think about when you get, if you were to get socked in the stomach, heaven forbid, your body, you go like this and your guts clench. And if anything happens that, it's going to hurt, you tense up.
Right.
And so that's absolutely for, again, these chronic pain issues, whether it's endo or anything else, you develop tension in areas. And then often that can make your body kind of off kilter in other areas too. And so it's like this cascade of events and a vicious cycle really, where pain leads to tension, leads to pain, leads to tension, leads to on and on.
Oh yeah. It's a snowball effect. And then your brain's already anticipating this is going to hurt. This is going to be painful. And you're just kind of like, oh, when's it going to start? And I think you're right. Relaxation and the breath. What types of exercises? They talk about movement so much for endometriosis being really helpful to kind of combat that inflammation and kind of get your body moving. But not every girl wants to go hop into the gym and be swole and, get active. What are some easy ways to step into activity with endo, especially when you have a brain response that this is going to hurt and it's not going to feel good?
Yeah. Well, that's a great question. And absolutely, when you are in pain, the last thing you want to do is exercise. And I wouldn't ever ask anyone to. I mean, when I have really bad cramps, I know that what I should do is some stretches or whatever. And it's hard to make yourself do that. So I totally get that. But I think if you have an arsenal of a few moves that you could at least try, first of all, just going on a gentle walk, and not a power walk or anything like that, but just a gentle walk. That rhythmic motion of walking is so good for your body. And it can just give you a boost of endorphins with that cardio activity, especially if you go outside and there's some fresh air, maybe some sunshine is helpful. But aside from walking, I love doing the butterfly stretch on my back. So Supta Baddha Konasana is the yogic term, but when you're lying on your back and you have your feet together and your knees flopped apart. I think that feels really nice, and it's really opening for your pelvic floor and your core muscles. Feels really good. Another one that I love is actually hip circles, and those can be done standing up. They can be done anywhere. And actually, I did a study. It was a very tiny study of like 3 people. So, nothing to write a journal article about, but it was with women with endometriosis. And the results were very positive in doing a hip circle program throughout the month. That not just when they were having pain, but kind of like the deep breathing. It's sort of like a buildup. You want to get this into your body so your body knows how to do this and how to deal with it over the months. So when you're having the pain hits, it's hopefully not as bad. And that was the result with women who did daily hip circles. So I think you can see me. I don't know. Yeah. If you're just circling out your hips, like you're drawing a circle on the ground beneath you, keeping your head and your shoulders fairly still. It's very relaxing and soothing for the internal organs, and it gently stretches and strengthens the core and pelvic area muscles. So it's a really nice, again, rhythmic activity that gently stimulates, but also relieves pressure and pain. So it's something worth trying, again, throughout the month on a daily basis. Just, wake up your day with 2 or 3 minutes of hip circles. And then maybe you can go back to that, have it in your back pocket when you're having pain, and it might help.
That is a great suggestion, and it's a nice, easy exercise. It doesn't mean you have to get to the gym and do anything intense. And you're right. I think just kind of loosening up that pelvic floor, that area, kind of stimulating those core muscles makes a lot of sense. So we have we call them hip circles, right?
Hip circles, yeah.
Hip circles, and then the butterfly stretch, where you flop open, and then breathing. And I think those are 3 really good exercises just to kind of be practicing on a daily basis for a few minutes, kind of settle and center yourself.
Yeah, exactly. I think daily basis is actually really key, because you've got to get that habit. You've got to make it a part of just who you are. Otherwise, it's really hard to call upon that when you're in a crisis moment, Yeah,
that makes a lot of sense. And, it's kind of like when you're dieting, you don't diet the day you're going on spring break. You have a healthy, fit, good diet throughout the year to try to hit a weight goal or be more healthy, be more active. And I think the same is true for exercise. It's a little bit every day. It's kind of establishing that good habit, because it's the movement over time that makes such a difference, not right away in the middle of a pain once a month.
Exactly. Yeah.
And is that why yoga has become so popular for endometriosis? Is it because of that stretching and that kind of movement and that practice of centering oneself? Is that kind of what you're seeing?
Absolutely. And again, the stress reduction, and just, I think also a big piece of all of this is getting to know your body. And the more you can, yoga really focuses on the core and the center. You have to have that awareness in order to have good alignment and not fall over in your yoga poses. And I think a lot of yoga teachers also talk about the root, or the chakras, the lower chakras. There's elements that really come into yoga classes in many situations. And I think that the more people get in touch with that area and raise that body awareness, the more it really helps overall with all sorts of women's health conditions.
Oh, I totally agree with that. And I want to move to your YouTube channel. So you have this awesome YouTube channel, and you make your videos free for everybody. And you have a variety of exercises and topics in your videos, right? So that would be a great resource maybe for endo women to get started with some stretches.
Yeah, I actually have a playlist. I really should have more that's dedicated to endo, but I don't have a lot right now. I have a really interesting interview about nutrition that definitely works for endo. It's actually specifically for endo. But for exercises, I have a whole playlist titled Pelvic Pain and Tension Relief. And so it's one of my playlists. If you look through on my channel, there's a bunch of different playlists, and that's one of the most, it's the one I recommend like multiple times a day to multiple people. It's again called Pelvic Pain and Tension Relief. And it's got a ton of great videos that are all specifically about just letting go. And, nothing aggravating, hopefully not aggravating, but nothing aggressive is what I'm trying to get out there.
No, that's great. And I think I'll make sure I link that playlist, with this video to make sure women can just get there right away. And I know that for me, with my stage 4 endo, doing daily stretches, doing daily yoga, doing daily movements, very similar. I mean, almost exactly what you're talking about has helped so much. So I guess I am a first-person witness that it does make a difference, and it is so beneficial for women suffering with that chronic pain every month.
Well, for sure. And also to tag along with this whole thing is anytime you're doing these techniques that center you, ground you, and calm you down, you're ultimately reducing overall generalized inflammation in your body. And if you're inflamed, because stress inflames us, it really, from the inside out. And so anything you can do to calm down that generalized inflammation is going to help with your pain response when you have your flares.
No, that you're absolutely right. I hope that everybody heard that, because endo is so inflammatory. It's such an inflammation-based disease. And the whole goal with diet, with exercise, with your practice is to get that inflammation down in the hopes that it reduces your pain and reduces your overall endo experience each month. And again, it works for me. I mean, I've had 2 surgeries, but it's been the holistic methods, kind of that healthy diet, certain exercises, pumping water, evening primrose supplements. That's what's made the biggest difference in my life for my endo. It's not the surgeries, it's my everyday.
Yeah, exactly. Oh, I'm so glad you found relief.
Thank you. Yeah, well, me too, because it's been a long battle. I know that we didn't really want to talk about this because we're not really promoting your book, but I have to share that I love your book so much. And I just want everybody to know it's called Lady Bits, and Dr. Bree literally wrote a book about kind of reclaiming your feminine health. Where can they find this if they're interested in checking it out?
It's on Amazon, so you can get it on Amazon.com, the Kindle version or the real version, which I like the real version personally because I like to flip through and look at pictures. But they're both good. There's a lot of little bits of information about your lady bits just your women's health.
No, I love it. I mean, you can tell like I've been highlighting and writing in it. It's a great book, and you've done such a really nice job. And I think it would be a good resource for women of all ages, just talking about your changes and the transitions, pelvic issues, and what to experience. So Thank
Oh,
you.
thank you for sharing that.
Oh my
Yeah.
gosh, of course. I'm so glad I remembered. You're such an advocate for women, and I just hope that people can check you out and look at your YouTube because it is beneficial. And thank you just for doing this giving this to us for free, basically. Thank you.
Oh, you're welcome. You're welcome. It's my pleasure. It's my passion, and it's my mission. So I do have some paid e-courses, but I try to keep, I really want the majority of my information to be completely accessible because there's so many women who don't have access or, to a healthcare provider that they can go see. Either they don't have the money or they literally don't have one nearby. I mean, luckily, I'm grateful to say that I've had women from all over the world reach out to me and say, thank you, because, they're not able to get to a doctor or to somebody who can give them the basic information. And I don't provide medical advice. It's not a substitute for medical treatment at all on my YouTube channel, but it's a way to help people get on the right path and ultimately, hopefully, arm them with knowledge for when they are able to see a healthcare provider on their own.
Yes. No, thank you so much because I love everything you talk about and your whole mission. And really, thank you for changing lives. We really appreciate it. And thank you for coming on today.
Oh, thank you.
You're welcome. I know there's a little delay since we're halfway around the world from each other, but really, thank you for coming on today. It's been great. And I have all the links below. Ladies, go check her out. You're going to want to look at Dr. Bree for some exercises and just relaxation techniques. And she's a wealth of information. So use it and love it.
Yay. Thank you so much.